Welcome to our video on supporting teens with trauma. As a parent, it can be heartbreaking to see your teen struggle with trauma. In this video, I'll provide guidance on how to create a safe and supportive environment, encourage professional help, and promote healing and recovery. Trauma can have a profound impact on teens, affecting their emotional, social, and academic development. Here are some potential effects of trauma on teen. Emotional effects, anxiety and depression. Teens who have experienced trauma may struggle with anxiety, depression, or both. Mood swings. Trauma can lead to intense emotional dysregulation, causing mood swings, irritability, and explosive behavior. Emotional numbing. Teens may experience emotional numbing, making it difficult for them to feel emotions or connect with others. Hypervigilance. Trauma can cause teens to become hypervigilant, always on the lookout for potential threats. Social effects. Teens who experience trauma may have difficulty with relationships. Trauma can make it challenging for teens to form and maintain healthy relationships with family and friends. Social withdrawal. Teens may experience withdrawal from social activities, feeling uncomfortable or feeling anxious around others. Difficulty with trust. Trauma can lead to trust issues, making it hard for teens to trust others or form close relationships. Aggression or violence. In some cases, trauma can lead to aggressive or violent behavior as teens struggle to manage their emotions. Now let's look at some academic effects. Difficulty with concentration. Trauma can affect a teen's ability to concentrate and focus, leading to poor academic performance. Memory and learning problems. Trauma can impact memory and learning, making it challenging for teens to absorb and retain new information. Avoidance behaviors. Teens may avoid certain subjects, activities, or situations that remind them of the traumatic event. Decreased motivation. Trauma can lead to decreased motivation, causing teens to lose interest in activities that they once enjoyed. Now, here are some physical effects. Sleep disturbances. Trauma can disrupt sleep patterns, leading to insomnia, nightmares, or sleep avoidance. Physical complaints. Teens may experience physical complaints such as headaches, stomach aches, or muscle tension. Substance abuse. In some cases, trauma can lead to substance abuse, as teens may try to self-medicate to manage their emotions. Self-harm or suicidal ideation. Trauma can increase the risk of self-harm or suicidal ideation, especially if teens feel overwhelmed or hopeless. Now, some long-term effects. Complex trauma. Repeated or prolonged exposure to trauma can lead to complex trauma, which can have long-lasting effects on mental and physical health. Mental health disorders. Trauma can increase the risk of developing mental health disorders such as post-traumatic stress disorder, depression, or anxiety disorders. Chronic health problems. Trauma can contribute to chronic health problems such as diabetes, hypertension, or cardiovascular disease. Difficulty with intimate relationships. Trauma can affect a teen's ability to form and maintain healthy, intimate relationships in adulthood. It's essential to remember that every teen's response to trauma is unique, and the effects of trauma can vary depending on the individual, the type of trauma, and the support that they receive. Creating a safe and supportive environment is critical for your teen's healing. Here are some tips to help you create a safe space. Establish a daily routine. Provide a safe space for your teen to express their emotions encourage open communication, and avoid being judgmental or critical. While your support is crucial, it's essential to encourage your teen to seek professional help. A mental health professional can provide your teen with the tools and strategies they need to manage their trauma. You can start by talking to your teen's pediatrician or school counselor who can provide recommendations for local therapists or counselors. Promoting healing and recovery requires patience, understanding, and compassion. Here are some additional tips to help you support your teen's healing. Establish a daily routine. Establishing a daily routine can provide a sense of structure and stability for your teen. Provide a safe space. Provide a safe space for your teen to express their emotions and process their trauma. Encourage open communication. Encourage open and honest communication with your teen and listen to them without judgment. Validate their emotions. Acknowledge their feelings. Acknowledgement of your teen's feelings and validating their emotions can be helpful. Avoid minimizing their experience. Avoid things like toughen up as an example. Show empathy and compassion. Show your teen empathy and compassion and let them know that you're there to support them. Seek professional help from a therapist or a counselor who specializes in trauma. Support your teen's therapy by attending sessions with them, helping them with homework assignments, and encouraging them to practice new skills. And follow up with regular appointments to ensure that your teen is receiving the support they need. Also, seek support for yourself from friends, family, or a therapist. Take breaks and practice self-care to avoid burnout. Prioritize your own physical and emotional health to ensure that you're able to support your teen. Educate yourself about trauma, its effects on teens, and the different types of therapy available. Avoid being judgmental or critical, as this can exacerbate your teen's feelings of shame and guilt. And focus on providing emotional support rather than trying to fix the problem. Supporting a teen with trauma requires patience, understanding, and compassion. By providing a safe and supportive environment, encouraging professional help, and taking care of yourself, you can help your teen heal and recover from their trauma. Remember, healing from trauma takes time, and it's essential to be patient and understanding. With the right support and guidance, your teen can learn to manage their trauma and live a happy, healthy life. If you're concerned about your teen's mental health or would like to learn more about supporting teens with trauma, consider reaching out to a mental health professional or a trusted resource in your community. That's it for today's video. Thank you so much for watching. And be sure to look in the descriptions, the video descriptions, for more resources and links to where you can get some help. See you next time.